subscribe now and press the bell icon. Never miss an update.
Welcome to Health Live at Seniors Today. We are delighted to have here with us Dr. Pratibha Mahajan, who's a senior dental surgeon and a consultant oral and maxillo-facial surgeon at the Department of Dental Services at the Sir H.N. Reliance Foundation Hospital and Research Center in Mumbai. This session is being conducted to coincide with the National Toothache Day on February 9. Dr. Mahajan is specialized in tooth extractions in difficult cases and medically compromised patients with complicated medical conditions like heart diseases, diabetes, kidney transplant, patients undergoing chemotherapy, radiotherapy, etc. And she has been among the top performers at the Government Dental College and Hospital in Mumbai during her BDS. After that, she did her post-graduation at KLE Bangalore in some years back. She did her super speciality fellowship training under internationally renowned surgeons in the country in the field of facial aesthetic surgery and facial reconstruction. She has several publications to her credit, and she has also delivered lectures at the gathering of medical and dental practitioners. Welcome to Health Live at Seniors Today, Dr. Mahajan. How have you been?
Good. Thank you so much. It's nice to be here.
Yeah, so we are, we are seniors today, and as I mentioned to you when we spoke earlier, that we have all senior citizens here, and while we've had dental surgeons, the dental practitioners as part of our forum in the past, we've not looked at very basic issues of toothache, which is something which happens to all of us. So over to you, Doctor, for your presentation. Would you like to, we could share your screen and make a presentation?
Yeah, good evening to all of you. Sorry for the rush, actually. But the point here is, am I audible?
Yes, you are audible. Thank you.
Yeah. So this is regarding the toothache and general dental problems nowadays. What dental this senior population around us faces. See, to be very frank, this used to be the scenario a few years back when you see a senior citizen, he's lost almost all his teeth, and they are with this couple of dentures with a denture box and some weirdly shaped toothbrushes to clean that those dentures. Okay, this was the scene earlier, but is it the same? Are we living in the same world? Of course not. The world has changed big way, and the industry as well has changed a lot. You people, you senior citizens, have earned enough to spend your rest of your retired life better way. So many of you go for this implant supported bridges, implant supported tweak, and fixed dentures as such. Am I right? So with advances in this lifestyle and this what do you say, the gadgets you're using, the armamentarium also keeps changing. So that is one thing I'm going to talk about here, that with the changed lifestyle of dental patients in this era, how you take care of your teeth cleaning and all. And otherwise, if you have teeth, what happens? So people who have teeth yet present, problems are having cavity, which are painful, which gives you the typical toothache. The reason for cavities is having decayed or the part of your food which is left behind, which we call an plaque in our terms. The plaque, when accumulates over the teeth surface, gives rise to cavities, and cavities is something when it hits your dental pulp, gives you pain. The very important and major reason for toothache, right? Then second reason in this population to have toothache is exposed root surfaces. Exposed root surfaces, because of age, the gums go down, and because of the certain age changes, the roots or the tooth surfaces get exposed, and they give you dental sensitivity or pain, right? So gum diseases is another problem where you get bad breath or pus or blood coming from your gums. Bunch of gum diseases called pyorrhea, periodontitis, etc., because of which teeth are lost. So teeth loss is a condition which we have to treat. And bad breath because of any of the reasons like unable to clean properly or having this pyorrhea kind of thing or pus in gums. All this causes certain bunch of dental problems, which is either you have cavities and you have cavities, or you don't have teeth and gum issues, and then following things because of the gum issues. So how do we address that? Plus, what I need to stress here more is the we all know now we live longer, and with that comes another bunch of problem that because our teeth are there serving us for very long time, they have certain issues like brittleness and sensitivity, etc. Then among us, we have a population because of the advances in medical sciences. We have people who fight and survive diseases like cancer. Those have undergone radiation most of the times and chemotherapy most of the times. So they have typical radiation caries. They have problem of dry mouth or burning of mouth, mucositis, etc., because of the drugs which are going on. Then in this age, we face different types of arthritis also, right? Which is which becomes a challenge then to efficiently brush, make movements efficiently, wrist movements efficiently, and giving enough time and attention to brushing. So brushing is challenged. And this is just like Parkinson's, where you get tremors or stiffness, again gives you challenge in cleaning your teeth. Daily routine becomes tough. So as a part of that, obviously cleaning also becomes tough. Then multiple medicines are going on, which cause certain gum diseases, conditions like diabetes, which cause more and more deterioration of your gums. All these things cause toothache, and because of the challenges in cleaning. So apart from normal brushes, for this particular age, particular group of people, now we have better advantages. As I said, we don't just wear removable dentures which fall apart anytime. We go for implants, and we go for multiple bridges over the implant where the teeth are taken very good care so they sustain for longer time. Then obviously we have to add extra care. So quickly I'm going to go through this next 2-3 slides where I'm going to introduce you to advanced tools to take care of your gums or teeth which are deteriorated. In this picture, as you say, there is differently shaped, differently designed small brushes which go to expose root surfaces and avoid root caries, root sensitivity, which is very annoying at this age. Then these are interdental brushes, very fine interdental brushes, which go in between your implant crown or teeth and helps you to clean between those big gaps, which happen to be at this age because of receding gums, right? Then apart from that, where there are easy ways, something called as water floss, water picks. As I said earlier also, dental plaque is the reason for many problems, gum problems and cavities and everything. So this water floss comes at your help that time. Rinsing again and again or brushing very efficiently in this age when it is not possible. Water floss is very efficient way, which is easy to use, fast, efficient to remove plaque. It's very gentle also on those all precious teeth, extra teeth which you have got. And it is very good to maintain your gum health. 2-3 years back, it used to be a huge apparatus like this, which now comes in a handy cordless way, where there are chargeable batteries and fine jet of water is under pressure. It is moved around your tooth. You can just move it around your tooth, and your mouth is cleansed of plaque, and the root cause of cavities and everything is taken away. These tools can help you really big way. Then we come to the age of electronic brushes. This multiply differently shaped and designed brushes are available in the market. their heads are designed in such a way that they can go into different areas of mouth very easily. At times, yeah, understand the plight of this age. At times it's difficult to even stand in front of that wash basin and hold the toothbrush in your mouth, and you don't know how long to keep brushing to be sure that everything is cleansed. Am I right? So in such difficult times when you are fighting with so many physical conditions, other physical conditions, these electronic brushes can really help you. They come with different shapes, and they're designed in such a way that they go all over the surfaces of the tooth, like unlike the typical rectangular brushes. As you can see here, it's not a typical rectangular brush. It goes all over, all around the tooth. They are built up with artificial intelligence, where there are timers. They beep after every 30 seconds, telling you when to stop in that particular region and when to move to the second or further region. And they help you in whitening and cleansing and giving you feel like almost polishing the teeth. And same time, it can even massage your gums. So timers is there, different modes are there of whitening and cleaning. You can fix on to some mode, use it. You can even have memory built up in those brushes, and use those particular modes again and again over. I'm not trying to advertise any particular brand or anything here. It's my honest effort to the senior population. I respect a lot. I respect the senior population a lot, who has gone through a lot in life and now facing certain challenges with their age and ailments. These tools can be really handy, very helpful. Make use of these tools. If you're not aware of them still, or if not introduced to such things, this is my humble effort to make you aware that there are things like this available in the market. Make good use of it. Take care of your implants, take care of your natural teeth which are remaining there, and please don't ever face any toothaches or any dental sensitivity. We are there to help you. Thank you. Thank you for listening to the presentation. I think we can go ahead with the discussion.
Thank you very much. Thank you very much. Those of you who have seen it over here, we will request Dr. Mahajan's office to send us the presentation, so it will be there as part of the video, which will be edited on Monday. It will be up on the website. So those of you who have questions for Dr. Mahajan, please put them over here, and we will ask questions. Some questions have already come to me by WhatsApp, so I will just ask them to Dr. Mahajan.
Sure.
Dr. Mahajan, the first question which is there, and I know some of it was there in your presentation, but how often would you think a senior citizen should go in for a dental checkup, even if I have not had any dental problems so far?
Yeah, that's a very good question, and everybody is curious to know that. Ideally, every 6 months, twice in a year, you should visit your dentist, whether you like them or not.
Twice in a year, you should be visiting your dentist, regardless of whether you have a problem or not.
Yes. Yeah. A stitch in time saves 9, right?
A stitch in time saves 9, and a stitch in time can save several cavities and
yes,
root canals.
exactly. If you're building up because of any changes in your health, you're building up too much of plaque, you are not able to clean it very often, we can clean it for you during your dental visit. And if that is a root cause, having the plaque, having the tartar there is a root cause, then it's better getting addressed quickly. So this kind of visits will help you to get insights on how to clean or get rid of it in time, so it doesn't develop into a cavity. A small inflammation of gum doesn't develop into pyorrhea, right?
Right. Doctor, I have another question that has come in. A lot of dentists talk about teeth cleaning, etc. But does it mean that the enamel gets worn out if you do it too excessively?
It's another very, very common query of each and every person. The way the instruments are designed, it is supposed to just create some ultrasonic vibrations over there and move the deposits on the teeth, be it stain or tartar or plaque, and get it flushed away from the tooth. So that instrument, the way it is designed, it nowhere can erode your enamel, even if you try to.
All
You
right.
understand?
Yeah.
It's
Yeah.
a probe which is very blunt. It just vibrates there. That too ultrasonically, means you can't see those vibrations. It just heard. When we touch your teeth, you can hear the typical vibration sound. It cannot erode your enamel. What happens is, it the area where we work is the area we call it nape of the tooth, where the crown and the root meets, which is very sensitive. It already has very thin layer of enamel, and beyond that, the sensitive part, the root starts, which doesn't have that thick layer of enamel. That is the area we work on, and that is the area which was blocked earlier because of the tartar you came to us with. We remove the tartar, and then you feel that area has become sensitive because it was blocked so far, and I unblocked it. So few days it remains sensitive, and then with healing it goes away. So it's a myth that cleaning of teeth causes sensitivity or tooth pain. It's absolute myth, and it is something you should never shy away from your dentist to get it done. At least once in a year or twice in a year, ideally.
Right. Yes. Thank you, doctor. Doctor, a question that I'm sure you asked several times over is, which toothpaste should one use for normal brushing? And I'll ask a question that has not been asked, but which toothbrush should one use for
This is very important. This is very important. Everybody has this doubt in mind. This is very important. See, I will not again promote any brand or anything. A toothpaste should be the one which has fluorides, and the cleansing action comes through abrasives. So I'm again not against about any pathy or ayurveda at all. It's the best therapy ever in anywhere in the world. But we the traditional methods of cleaning, those mishri and stuff, same thing happens with some of the ayurvedic toothpaste. They have hard abrasives. Abrasives means those granular parts which cleanse your teeth. That gives you feeling of everything getting cleansed and a fresh feeling in mouth. So a toothpaste should have fine abrasives, and it should have fluoride always. The flavors and colors and everything, it's all fancy here, I think, but it should have fluoride. Any toothpaste which has fluorides and which does not have harsh abrasives is good enough toothpaste. And the toothpaste hardly matters. The way you apply the brush over teeth, that matters. If you're just pushing a lot of pressure and moving your brush this way, it's not the right way. You should move your brush up and down, circular, or up and down again from inside out. Those are typical 5 motions we teach everybody who visits dental clinic ever. That matters. And about the brush, it should be having medium to soft bristles and blunt bristles, not sharp bristles, and a design which can reach to the corners of teeth well. There's
Right.
nothing particular otherwise.
Right. Thank you, doctor. We have a question from Lakshmi Vishwanath, who asks, what could be the reason for teeth breaking off and sharp edges hurting the tongue? Can taking some sort of calcium tablets or certain food help control it?
Very good question, Lakshmi ji. No food can stop it. Okay. To be very honest, our teeth are formed when we are in mother's womb. Back then, even our permanent teeth, they are in the formation when we are in our mother's womb, and when by the time we are born, all the teeth are almost done with their formation part. And once the enamel is formed, nothing can be added to it. Only something can go away from that, which happens because of hard brushing, erosions, which at times happens because of the citric things, lime juice and things people take empty stomach early in the morning, and acidic things if they are taken very oftenly. That causes erosion of teeth, or hard brushing causes adhesion of teeth that takes away the enamel. but nothing can add into enamel, nothing can add into the formation of enamel once they are formed. Only thing that you have to take care of what nature has given to you.
Absolutely, I agree with you. Uh, Doctor, there is a question from Narendra Acharya. His question is, my dentist says my layer of enamel is thin or weak. What can be done?
Please practice gentle brushing. Don't be harsh while brushing. Be efficient, but don't be harsh. Then avoid citric food and use a paste which has fluoride, good enough amount of fluoride. And at times, if it is too sensitive, or times when it is sensitive, you can even use desensitizing paste for a while. And while using the desensitizing paste, allow the foam to stay there. That is when this chemical reaction of repairing of enamel happens by passing on some salts over the enamel which is damaged. And then uh, it forms a barrier between the dentin and the enamel. Dentin is that sensitive part. We cannot add on to anything on the enamel. We do restorations, that's different part. Naturally, we cannot add anything. Only thing we can stop the signal, pain signal going to the dentin, which happens with desensitizing pests. So create a foam of desensitizing paste there, allow it to stay there for a minute or two, and rinse it off. And just like you apply a medicine and don't touch, don't eat or don't gargle immediately. That will help to form reparative dentin. And then the the problems which you are facing because of thin enamel will be taken care by forming this reparative dentin, which will act like a dressing to your sensitive teeth.
Right,
I
Doctor.
hope
Yeah, excellent response, Doctor. Doctor, there's a question about the toothpaste is generally sweet, and I'm diabetic. Is there a possibility of my diabetes increasing because of the toothpaste? Sometimes, some toothpaste content could be consumed.
it's a very, very interesting question. Yeah, only a person who has gone through can think of this. But I don't think the amount of sugar is that much. And the absorption, no, think about it. It's then in your mouth for few minutes, right? And you rinse it off. So during that short period, how much amount of it will be actually absorbed in blood? I don't think it's so significant to rise the blood sugars. I doubt.
Doctor, there's a question from Arun Anandjiwala, and this is in Hindi, but I'll just translate it in English. He asks, is it necessary to have, after consuming anything sweet, is it good to brush your teeth after every time you do that?
Yes, that's the ideal thing you can do, because many a times this sweet things are sugar sticky also, right? And that part which sticks behind it, the irregularities of your teeth, is the basic reason for having cavities. So it's very ideal scenario where you brush after taking sugars. If not possible, at least rinse off, at least neutralize, wash away those sugars from your teeth surface and bring it back to neutral acidity, pH, neutral pH, so that cavities won't happen.
Right. So there's a question from Katie Daranji who asks something that you already said, but is it better to brush one teeth after breakfast, lunch, and dinner to keep plaque at the minimum?
That will be the most ideal thing to do.
Right. And
so they say as many times as you eat, your teeth should be cleansed that many times. So breakfast, lunch, dinner.
Right, absolutely.
And if not possible, at least then once in the morning, once in night. At the end of all the eating part is over, then definitely there should be a round of brush. Certainly.
Doctor, I would normally not like to take a brand of a toothpaste over here, but it's an interesting question by Mr. Narendra Acharya. He asks, can I use Sensodyne toothpaste permanently?
No, never. As I said, desensitizing paste should be used only for a while, only for 2-3 weeks, as long as you have the sensitivity symptoms. because we assume that this particular sensitivity is because of opening of dentinal tubules due to erosion of enamel, which is the outermost surface. And to block off that, to dress it up, we use desensitizing paste. And we block the signal, pain signal going to your brain from the tooth. Imagine if you're always using that, even if you have a cavity, even if you have a fractured tooth, none of this will give you the pain signal. And the tooth will go on destroying without you getting aware of it. So it's absolutely a wrong thing. And many people end up doing this. Sometime in the line, doctor tells them to use Sensodyne, and then Sensodyne becomes their regular paste, and they don't come to know even if their teeth are vanished out of caries. So never use a desensitizing paste as your regular paste.
Right. Doctor, there are two more questions. One is, this is an anonymous attendee. Are sugars acidic in nature? Unsugared lemon juice in lots of water on an empty stomach, is that acidic and will it harm the teeth?
Sugars are not acidic in nature. Sugars provide food to the colonies of bacteria which are there in mouth. Sugars mostly they get stick, as I said earlier. They are in sticky form in our candies and these things. They are in sticky form, or they stay back in the crevices of teeth. There you have bacteria. It acts as a food to the bacteria, which secrete, pump out acids over the tooth, which demineralizes your tooth. That demineralized, decalcified area of your tooth is called cavity.
Right. So there's an interesting question that has been asked here, and which is, Doctor, you are part of a large hospital in Mumbai, but we've never gone to a dentist in a hospital. Would you advise that one should be visiting dentists in hospital, or clinics good enough? It's a tricky question. I know this session has been.
It is a tricky question. So,
right.
Do you like to shop in standalone shops, or you like to go to mall? Jokes apart. At this particular age, when you have comorbidities, right? You have hypertension. You might have had some cardiac incidences in your life, angina or heart attack, maybe at some time. You might have undergone some transplants or angioplasties, bypasses. You might have some pacemakers sitting here and there and things like that, right? So this is a very delicate age where you have comorbidities. And a dentist who is treating you should be very well versed with what you have in your body simultaneously happening. You're on ecostrin, you're on other blood thinners like clopidogrel or something. You're taking some antihypertensives, you're taking or not taking your anti-diabetic things, and your sugars are under control or not. All these things need to be considered when it comes to your dental treatment, especially removal of teeth or putting an implant, your bone density, your arthritis condition. All this has to be considered. We are taught to consider all this when we are taught dentistry itself. But when you go to a dental clinic where all this thing is handy, everything is there, all the facilities are there, obviously you are treated in a different way and at different level, isn't it? The level of care you get will be obviously different. I'm not trying to boast myself. I'm just trying to make you understand the spectrum we consider and the things which are handy to us, being sitting in a multi-speciality hospital.
Right. So is it a good practice that, if you have had any of these issues, you've had a heart issue, etc. So it is then better to do the dental treatment also in conjunction with your specialists, etc. Is that something that you advise?
Isn't it? If it is my mother who has undergone one infarct sometime in life, and I have to remove her multiple teeth, I'll be more comfortable doing it in a hospital where, in case she gets infarct again or something goes wrong with the heart condition, existing heart condition, I can immediately get help. Or I have a cardiac surgeon who is observing her same time, cardiac physician observing her. Okay, she is fit to go through this. And if at all something goes wrong, he's there to help me out. I would think in this way,
Right.
right?
Yeah, Doctor, even as I said, two more questions. There are two more questions that have come in. I think they're interesting, which I must ask. One is Mr. Arun Anandjiwala, who says, it's a question in Hindi, but I'll put it in English. He says, is it true that a person who snores, her or his teeth get spoiled early? Is there any truth in it?
Yes, yes. This is what happens with kids who breathe through mouth. There are some kids who breathe through mouth, and then their mouth become dry. Saliva plays a very important role. Our own saliva, which keeps bathing our teeth, is a very big protective phenomena. Because of that, the acids are getting neutralized. There are some buffers in our saliva, there are some enzymes, and that keeps our teeth protected. When a person breathes through mouth or snores in the night, all through the night, his mouth is open, his teeth becomes dry, his gums become dry, and they become more vulnerable to cavities and gum diseases, definitely.
Doctor, one
This
last
happens to
question.
kids also.
Thank you. Doctor, one last question, and this is a question in Hindi. Read out. This is Mr. Arun Khenkar, and one can respond in English. ऊपर वाले पीछे से दूसरे बाएं वाले दांत में चबाने पर दर्द होता है. एनामल एकदम ठीक है. एक्सरे करके डॉक्टर ने बताया कि ड्रिल करके भरना पड़ेगा. एक हफ्ते के बाद अगर दर्द रहे तो और सीटी करना पड़ेगा. So basically,
It's a particular tooth he's pointing to where he gets pain, right? That has to be seen clinically. Cannot judge just by hearing the symptom. If it is a cavity, or if it is a exposed root, or what it is, and cavity, if it is there, then how deep cavity? It has to be seen clinically. We cannot just.
And one last question, Doctor. This is an interesting question again. This is from Mr. Brish Duggal, who has been one of our regular attendees. Is there any organization standardizing the charges for dental treatments in India?
I so wish it was, but yeah, there is no body who governs it. But do you ask this question to drillers? So by and large, in some area, there is some consideration that rates are this way, or market rates of my supplies is going this way, so treatment rate will go according to that kind of. So everybody, we live in a society. Yeah, there are people.
So it's market dynamics that decide the rates charged by doctors.
Yeah,
I guess
with
that's
root
the
canal
question.
instruments, the cost of root canal instruments was different earlier. Now it is much. The cost of labs where we prepare the porcelain teeth and all, it was much less earlier. Now it is pretty much high. So according to that, the person who prepares the crown for me in the lab, whatever inventories he requires and whatever manual power he requires, that changes. Then the cost of the crown will also change.
Right, absolutely. I appreciate. I'm not agree. I'm not saying that that's how it should be, but clearly, I guess that's what is the reality. Thank you very much, Dr. Mahajan, for being here.
It was really nice. Questions were really interesting. It was fun to answer them. I hope it was helpful to the listeners.
The very fact that we've had around 35 people here, more, and there are people who are watching it elsewhere on Facebook, etc., just does indicate that every time we've had a person here, a dental surgeon here, the number of questions that have come in are a fair number, and it just shows that people have questions for specialized, for professionals like yourself, and there are enough and more people who have questions and who want their problem solved. Thank you very much,
Thank
Dr.
you so
Mahajan, for
much.
being here. And
Thank you for calling.
thank you to the HN Reliance Hospital for facilitating this. For all of you over here, we will be back once again next Saturday at 5 p.m. with another session of Health Life and Seniors Today. Also alert you that on the 15th of this month, that is just a few days away, we will be having the next issue of Seniors Today, the February 15th issue of Seniors Today, which will be available online as always, free of cost as always, and you can access the magazine online, and of course you can subscribe to our newsletters and get updated of or whatever else is happening. It's an interesting issue. It's our annual feature that we do every year, and you must look forward to it. Thank you very much once again, Dr. Mahajan. Thank you.
Thank you.
Subscribe now and press the bell icon. Never miss an update.